tension headache. Imagine someone pressing on your head from both sides without stopping. This is exactly what tension headache sufferers describe. It's the most common type of headache on Earth, affecting between 30 and 78% of people at some point in their lives. On the VAS scale, which ranges from 0 to 10, this type of headache typically falls between 3 and 5, meaning it's painful enough to distract you, but not debilitating. The main cause is the continuous contraction of muscles in the neck, scalp, and shoulders, often due to stress or prolonged sitting in poor posture in front of screens. A defining characteristic is that the pain is bilateral, encircling the entire head like a tight band, and is not throbbing, but rather a constant pressing sensation. It's usually not accompanied by nausea or extreme sensitivity to light or sound, which distinguishes it from a migraine. It can last from 30 minutes to 7 hours, and in some people, it can develop into a chronic tension headache, occurring more than 15 days a month for over 3 consecutive months. Migraine. Migraine is not just a severe headache. It is a complex neurological disorder classified by the World Health Organization as one of the top 20 most disabling conditions worldwide. It affects approximately 15% of the global population, with women being 3 times more likely to experience it than men due to hormonal influences. On a pain scale, migraine attacks often reach a level of 7 or 8, and in some severe cases, approach 9. The pain is throbbing, usually unilateral, and intensifies with even slight movements, such as walking or climbing stairs. What makes migraine biologically unique is that it originates deep within the brain through a wave of electrical activity called CSD, cortical spreading depression, which spreads across the cerebral cortex at a rate of 3 millimeters per minute. This wave explains the aura experienced by about 25% to 30% of migraine sufferers, manifesting as flashing lights, blind spots, or zigzag lines in the visual field that precede the headache by 20 to 60 minutes. A full attack can last from 4 to 72 hours, during which light, sound, and even pleasant smells become hostile. Hormonal headache. A woman's hormonal system operates in precise and regulated cycles, and any disruption to estrogen levels can turn this regulation into a source of pain. Between 50 and 60% of women who suffer from migraines notice a clear link between their attacks and their menstrual cycle. The root cause is the sharp drop in estrogen during the first 2 days before menstruation. This drop activates the CGRP, calcitonin gene-related peptide system, which is responsible for dilating blood vessels and activating pain pathways in the brain. This condition is officially called menstrually related migraine and is longer lasting and more difficult to treat than regular migraine attacks, often reaching a pain level of 8. Hormonal contraceptives further complicate matters. When they are stopped or changed, estrogen drops suddenly, triggering new attacks. Pregnancy, breastfeeding, and natural menopause are major hormonal milestones, each of which can fundamentally alter the pattern of this type of headache. Caffeine headache. Caffeine is a psychoactive substance that humans consume over 2 billion cups of daily, making withdrawal headaches one of the most underdiagnosed types of headaches in the world. Caffeine works by blocking adenosine receptors in the brain, receptors responsible for feelings of sleepiness and vasodilation. When caffeine is suddenly absent, these receptors open all at once, causing blood vessels to dilate rapidly, creating a throbbing pressure that the brain interprets as a headache. This headache typically begins 12 to 24 hours after the last dose, peaks between 8 and 1:51 p.m., and averages a pain level of 5 or 6. Physiologically, what's even more interesting is that a very small dose of caffeine, between 100 and 200 milligrams, is enough to stop the attack in less than 45 minutes. A person who drinks coffee daily and then sleeps in on a day off sleeps an extra 2 hours and wakes up with a headache they mistake for oversleeping, when in reality, their body is simply craving its usual dose. Thunderclap headache. The name perfectly describes the experience. In less than 60 seconds, the headache reaches its absolute peak without any warning, as if lightning has struck the skull. Those who have experienced it describe it as the worst headache of their entire lives. And this phrase has become an official clinical warning sign that alerts doctors immediately. Approximately 11 to 25% of severe cases are associated with a subarachnoid hemorrhage, a leak of blood around the brain that constitutes a direct, life-threatening emergency. Other causes include cerebral vasospasm, venous sinus thrombosis, and meningitis, all of which are serious conditions. On a pain scale, it instantly reaches 10. Even if it disappears within an hour and the patient feels completely better, this does not mean it was a minor headache. In every hospital worldwide, this type of headache is treated as an emergency until proven otherwise by CT scans and cerebrospinal fluid analysis. Waiting is not an option. Post-traumatic headache. The human brain doesn't easily forget trauma, even seemingly minor ones. Post-traumatic headache is one of the most common and longest-lasting symptoms of concussion, appearing within 7 days of the head injury and often persisting for months. Statistics indicate that between 30 and 90% of concussion patients experience it, and in 18 to 22% of these cases, it develops into a chronic headache lasting more than 3 months, known as post-concussion syndrome. Biologically, the injury triggers a surge in glutamate release and calcium influx into nerve cells, disrupting cellular energy balance and causing microinflammatory neuropathy that persists long after external healing. The person may appear healthy, returning to work or school, but carries a daily headache ranging from a 4 to a 7 on the intensity scale, which intensifies with light, ambient noise, and demands of mental concentration. The problem is that a premature return to physical or mental activity slows down recovery and prolongs the headache, making genuine rest an essential part of the treatment, not just a luxury.